It's good to have, Jill from a psychology perspective, Sarah from a speech and language therapy perspective, to touch on the topic on multidisciplinary diagnosis and management. Let's face it, I think ARFID is a whole journey. And we thought it's good to have a discussion on our individual experiences with working with a multidisciplinary team. And Sarah, what is your experience around ARFID and working with multidisciplinary team?
Well, because I've been very lucky because I have always worked very closely with a clinical psychologist, which I think is a bit of a luxury. So from that point of view, I mean, I've just learnt so much from Jill and I being in a joint clinic. But I think it's often issues to do with dietetics where we kind of look to get help from someone like yourself. It's sort of issues like, how can we be sure they're getting the minerals and vitamins that they need?
And that's a similar situation. I think we are complementary to each other, is that I, for example, as a dietitian, many of them have got sensory issues, and I rely heavily on speech and language therapy to guide me to say, okay, Roseanne, this is what you should do in terms of foods, but energy, protein, vitamins and minerals. But I also rely heavily on psychology to guide me on what can I do in terms of introduction? What is too far? And I think that's a really important one. Jill, what is your experience with multidisciplinary working?
Well, yes, I've learned from Sarah, of course, about oral processing and oral sensitivity, and we all worked closely with the dietitian at Children's Hospital when we were running the clinics together. So that was, we had to have that grouping going. But we've learned from each other, and I think with psychology there are some basic facts that anybody can pick up, really, as a health professional. You might not want to do relaxation and cognitive behavior therapy or any of the other therapies, but just the basic sort of things that you should and shouldn't do that a psychologist would teach you, give you information about, that you can pick up and use. So I think multidisciplinary is learning from each other as well as relying on each other.
Absolutely. And I think that's such an important point, because I can imagine many healthcare professionals listening to this to say, actually, we don't have anybody around. And I thought the first factor just to discuss is, whom else have you worked with around ARFID whom you found extremely useful, Joe? Because I think you mentioned school, whom we've worked with.
Yeah. I mean, we've worked in some special schools, and I would just remember one where there was a teacher who specialised in sort of food technology, and he was absolutely brilliant in moving children with ARFID on. It was a school that specialised mainly in children with autism, and I was amazed at just what he was doing, how well he was doing it. It was just basic principles that he'd picked up from psychology and from speech and language therapy.
And I have I work a lot with occupational therapy, and of course, doing more gastro, I heavily rely on the doctors. And I think that's also really important to say that all of us, we need our doctors, whether that's a child developmental specialist, because, you need them from different categories, or whether there's a gastro diagnosis, you need a gastroenterologist or a general pediatrician or an allergist. But we need that, because if medical management is not optimal, meaning that the factor that actually leads to the sensory problems ongoing, because if I've got a child that's constantly got abdominal pain, forget it. They're not going to try any new foods. But also I've worked with amazing nurses. So I think this, just thinking that the team is limited to a doctor, dietitian, psychologist, speech and language therapist, we need to be thinking outside of the block.
Well,
Sarah,
I think you're absolutely right. And speech and language therapists are often involved in the early sort of sensory work, but we can't do it every day, and you've got to find someone to do it. And it often isn't, well, it's not a question whether it's a parent or it's a nurse, if you're in hospital, or a teacher. It's about people who are happy doing that kind of sensory play, because some adults can't do it. And it's finding that right person who's very happy working with messy play. And you can find that in different professions or different groupings, parents. So that's part of it as well, isn't it?
Yeah.
I mean, certainly nursery nurses and the old Sure Start teams were really good at it. you know,
Yes,
parents
absolutely.
weren't able to do it, they could. So I think when you think about a multidisciplinary team, you're thinking of a much wider than that sort of, we're just going to have 3 people sitting in a room and
Exactly.
yes,
assessing. Yeah.
yes.
Exactly. And I think also it's about reflection of what have we got within my community? What can we use? And then what has the family got within their environment? Yeah, we've got a nursery, and yes, they do this, and also we've got a school, we've got somebody interested. But I think for us as healthcare professionals, Sarah, you used in our pre-discussion the word we shouldn't be siloing ourselves just to do to just what we do, but
Yes.
we've learned from each other, go on to courses, but it's also you know, we all have some honorary titles of speech therapy, psychology somewhere hanging around. I mean, do you both feel comfortable to stretch yourself and saying, actually, you're not getting sufficient? I think until you see the dietitian, I don't think you are getting sufficient food. I mean, do you feel comfortable with saying something like that?
I think that it's important to know what you don't know.
Yes,
Of
absolutely.
course.
You can go so far. I can sort of say these foods are high in calcium, these foods are high in calories. But then when I go into the micronutrients, I need somebody who
Of
can
course.
just.
Absolutely, yes, absolutely.
And that's the same for me for you know, I can kind of go, you know, in terms of messy play and textures, you know, things like that, but I would never in terms of the golden orifice, the mouth, I don't, you know, I don't have the qualifications to kind of go, you should be at those textures.
Yes.
So I might just say, until you see somebody do messy play and you can do this. But it's really trying to see and stretching yourself, and we often have to try to stretch ourselves because we don't have the resources around.
And I think that's the sort of final point, possibly, if it's the final point, is that you should know what not to say.
Yes.
Don't just say something because you read it somewhere else or because you thought it up and it might be a good idea, or you used it with one of your children and it worked.
And I think that is particularly important now when we have this remote consultation where we're not in the same room with somebody. It's a lot of times that you know, I don't have somebody else that is a speech and language or a psychologist with me in the consultation where I go, you know what, I don't know, but you know what, I'm going to talk to your psychologist or to your speech and language therapist, and I'll come back, because you don't have that immediate feedback.
Yes. I mean, I think the thing is, if you just stayed in your silo, you wouldn't be able to answer any of the sort of more general questions. And you feel as though there's a basic level of knowledge about our food that we could all have, that we all share. And then there's those bits, aren't there, where you recognise this is where I need to go to Roseanne, this is where I go to Jill, or whatever.
Exactly. And one of the recordings was with a mom with a child with ARFID that is also part of this course, and she's one of the trustees. And the advice that she said it's the listening of the healthcare professionals and the communication between them. Because she said it was only when she said she had lots of different healthcare professionals, each one of them took a little bit of a part of the history, but it was only one person that at the end put it all together. And I think that's so important, is this listening and overlapping sometimes into somebody else's domain to understand.
Because actually, I think maybe there's a point there that, you know, the old idea of multidisciplinary team working was, you know, you got everybody into a room, all these different professionals, and this was great. But actually, that was very overpowering for parents. And actually, it's much easier if you've got 1 or 2 people that you're doing the very detailed case history, and then you're pulling in people as you need them.
Absolutely. I don't know, Jo, that's your experience too?
Yeah, many parents have said to me, it's terrifying. They're going with their child and there's a row of professionals sitting there in judgment, you know, and they're absolutely petrified of doing that. Yeah.
And I think also the expectation then on us, because you have to remember that many of those parents have waited sometimes up to a year to see a multidisciplinary team. And they might have, if they're lucky, an hour, and there's suddenly 5 healthcare professionals. And within an hour, they have to get a whole lifetime of feeding difficulties. And I think this is maybe for a last comment from my side, is I think where remote consultations have been really useful to kind of just pull people in.
There is a lot to be said for it, and that intimacy and relaxation of being in your own home as well, isn't there?
Absolutely. So thank you for those thoughts on multidisciplinary. I hope that our healthcare professionals find it very useful and reflect in particular on the help that they have within their community. It's sometimes really useful just to make a list and saying, okay, these are the useful people. And my last tip is also, it's not only who's useful, but who is passionate about ARFID. If you find somebody that's passionate, they will actually stretch themselves and work around this.
They
Thank
ask
you
the
all.
right questions.
Yes, thank you all for those last thoughts.